Hi, I'm Dr. Roadhouse, and I want to introduce you to my patient, Sandra Henderson. And Sandra has been here about 3 months now.
3 months, yeah.
Okay. So anyway, I guess what we like to do is basically you're autoimmune. You know, we've got a thyroid problem. We found it. No one else found it, based on all the testing that we did. And I guess what I'd like you to do is just kind of go through the journey that you had, you know, before you even got here. Now, you don't have to say everything about every doctor and stuff like that, but just kind of, you know, so people have the idea kind of what you've been through, okay?
Let's see, well, I started out, I had tremors. I started out, the tremors started getting worse.
And where were the tremors?
My head,
Mm-hmm.
and my tongue,
Mm-hmm.
and my hands.
Okay.
My right toe, it used to have a tremor, but it does not have a tremor no more. And then my leg, I could not lift it, and doctors could not figure out why.
Mm-hmm. What, did they do tests on it and
they
MRIs
did
and all
tests,
that?
they did CT scans, the MRIs,
Did
they did
do the needle
ultrasounds.
the ultrasound? Okay, did
They
they do the
did
needle
the
with
nerve
the needle? Okay, all right.
test,
And
yes.
everything came back normal?
Yeah.
Okay, all right.
Everything came back. So, and I was just really frustrated. I wasn't getting any better. I was going downhill. I mean, I was to the point where I couldn't work because of my tremors so bad. I couldn't move. My mobility was lacking. And doctors really didn't have an answer. They just kept on giving me pills. Say, well, this pill will help that, this pill will help that. And I don't know, I wasn't getting anywhere. So finally I heard of Dr. Roadhouse, and I started coming here. And since I've started coming here, my tremors are a lot less than they used to be. And I am now starting to lift my leg a little bit with the therapy and the work that you've been
Okay, so talk about, I mean, because when you get nervous now, because you know stress affects the cerebellum, we talk about it, your head tremor comes back a little bit, but
yeah.
But I mean, in comparison to when you first came in, I mean,
it was a lot.
Yeah,
it was all the time.
Yeah, and it's just 3 months. Yeah, do you get the tongue tremors anymore?
A little bit, but not as bad.
Okay. All right.
Yeah.
And what about the
yes,
hands?
they've gone down. The hands, yes, still,
Okay. All right.
yes.
And the big toe?
No.
Okay.
Not no more.
All right. Okay, so when you you know, talked about that they gave you, how many different prescriptions do you think that they gave you, and how many different just?
Oh my goodness.
How many
Well,
doctors?
for the tremors, they gave me blood pressure medicine, and they kept on trying different blood pressure because I guess it's the beta
Blocker.
blocker.
I've had other patients that they did that too. Yeah.
And I don't know why. I've never had high blood pressure, but that was their answer. And
okay.
I
So
mean,
how many doctors do you think when this started and everything, you know, how many doctors do you think you've been to?
Probably 7 or 8.
Okay, all right.
Yeah.
And how long did this go for? I mean, what time period are we talking about?
We are talking a year, probably a year and 2 months.
Before you came in
Yes.
here. Okay,
And then
all
I
right,
started
okay.
coming here.
So what about some of the other symptoms like sleep? Can you sleep without medicine?
I can now. Before I was taking the tramadol. I was on tramadol daily.
Okay.
And
now you're
that was
sleeping.
helping. And now I'm sleeping.
In the last 3 months?
I am sleeping through
okay.
the night.
Okay, great.
Yeah.
Okay, what about any of the trouble like with the cold hands and feet and the tingliness, any of the headaches during the day, the stomach, the bowel and all that
headaches,
stuff?
let's see, we are getting that back on track. Yeah, before it was, I mean, it was really messing my system up.
Okay.
So it threw my system off. And then you got it back on track with the supplements.
Okay.
And yeah.
And all the protocol that we're doing.
Uh-huh.
Okay, what about, were you having any stomach issues or anything like that?
I was having stomach issues. I was having a lot of diarrhea.
And how's that?
It's good.
Okay.
It's good.
All right. And that's just
it's
in
gone.
the last 3 months,
It flares up if I
Yeah.
get real nervous, but
Mhm.
I don't have as many flare-ups. So,
Yeah.
I mean, that's,
Yeah. that's really good, you know, just for 3 months, and we've got you on the, you
Yeah.
know, the
Yeah.
1-year plan, you know, because it's going to take some time.
Yeah.
Okay, so what about like sensitive to light? Do you have any problem with that anymore?
Mm-mm.
Okay, so you can
No.
be in, because you still kind of look like you squint a little bit, but nothing like before,
Yeah.
you know, when
Yeah.
you came in.
Yeah, it does bother me a little bit, but
Okay. All right.
it's gone way down. I think it's really helped me come here. It's waking up my system.
Mhm. Okay. Well, I think what we'll do with that is, also, you know, all this stuff we found were the lab tests and, you know, all the tests we done, and none of the other doctors that you've been to even knew,
Mm-mm.
you know, told you about these
No.
tests or ran any of these
They
kind
never
of tests.
did
right?
any of those tests at all.
Okay,
No.
well, that's where we found the information from. So
Yeah.
I think what we're gonna do is, you've had good improvement in 3 months, so what I wanna let you do is maybe go a couple months and we'll come back and check in with, I wanna do it chronologically
Okay.
as you get better. I really wish we'd
Okay.
have done it when you first came in, so people could really see how bad your
Yeah.
head tremors were, but, we're just glad they're gone, you know what I'm
Yeah.
saying?
Yeah.
And we'll just work on it in the future, so we'll just check in, but I wanna thank you, and I'm so happy for your results, and I'm sure your family
Me
is too,
too.
you know?
Oh, yes. Yeah.
Okay, all right, we'll see you
Yeah.
soon.